Welcome back, everyone. For more than 15 years, American Health Imaging has provided quality diagnostic imaging at an affordable cost. President and CEO Scott Arendt and COO Dan Valentine recently joined me to explain how they do it. Take a look. Good morning and welcome back.
Good morning.
Oh, it's great to have you both here, but if somebody might have missed last time you were on the show, tell everyone about American Health Imaging.
So American Health Imaging is an outpatient, non-hospital medical imaging company here in Atlanta, Georgia. Started out as one little center back in Decatur almost 18 years ago and have grown to 13 centers around Metro Atlanta.
Fantastic. And you are Georgia's largest network of non-hospital imaging centers. Why is that so important?
Well, I think non-hospital is the key because truly nowadays we talk about people taking control of their healthcare costs, and the non-hospital piece is what allows us to achieve that. So as being a non-hospital outpatient company, we bill on different fee schedules.
Good.
We also lose some of the negotiating power when it comes to setting our rates, and thus people are able to save pretty significantly with us.
Okay, well, go into more detail with that, because when we hear savings, I think all of us, are like, sign me up, because this can be so expensive, and having to deal with the insurance companies, I mean, it's kind of overwhelming. So how is the cost to the patient so low with you?
So the thing to keep in mind is all insurance companies have a contracted rate with all providers out there. Hospitals are very different than from an American Health Imaging type of company. Again, it's the contracted rate that is so important. So when you contact your insurance company, or the provider, I should say, ask what the contracted rate is. If you go to a hospital in Atlanta, anywhere in Atlanta for that matter, you're going to pay about $2,000 to $3,000 for a typical MRI scan.
Wow.
American Health Imaging's contracted rates are between $500 and $600. Done for the same exact scans, done for the same exact reasons, and read many times by the same exact radiologist.
Okay, so how are the hospitals, why are they charging these rates? I mean, that's just the contracted rate.
Well, they can. They're a very large entity. They have lots and lots of things in which they bill for. We have just a few. We're an MRI and CT specialist company. That's all we do. We're able to get our costs down. Hospitals have a much bigger infrastructure in which to pay for, and there's bigger salaries at the administrative level.
Got it, got it. So many employer healthcare programs are, of course, moving to higher deductibles. So what type of saving can a patient expect if his or her deductible hasn't been met?
So I think for the average patient who may have a $5,000 deductible,
right,
if you go have that MRI or CT done, you can expect to pay for the whole thing. And
right,
so if you're at the hospital and let's say it's $3,000, you can expect to come out of pocket for the entire $3,000. The other thing that sets us apart is we bill globally, which means you get one bill for one exam. Most of the hospitals, typically you'll get the bill for the exam, and then you'll get a bill from the radiologist.
They just
and
keep coming in.
There's some additional fees they'll tack on there, facility fees and what have you. So we try to make it's simpler to understand. Before you show up, you know exactly what the out-of-pocket or a really good estimate of what the out-of-pocket expense will be. And then there's no surprises on the back end.
Right, and at the end of the day, you're not sacrificing quality.
Right.
We want to make sure everyone understands your radiologist qualifications, same as you'd find anywhere, right, in a hospital.
At any hospital. They're all board certified, subspecialized radiologists. We have 20 to 40, I think, radiologists that do professional interpretations for us, but they also read for hospitals too. So when it comes to the radiologist, just as good as anywhere.
Sure, and talk to us more about that, your outstanding customer service. What can we expect?
So when you come to American Health Imaging, the great thing is you can pull up right to the front door. You walk in, you get your scan. It usually takes maybe up to an hour, but typically are uncommonly over that.
Right.
But you can, when you come in, there's going to be somebody that greets you. They're going to call you by name. Then there's going to be somebody that gives you the very minimal paperwork. Then you get your scan. Takes 20 to 30 minutes, and you're walking out the door all inside of an hour. You go to a hospital setting, it's going to be a whole different ballgame.
Sure is.
You could be there all day.
And once again, go back to that global pricing in case anybody missed that, and really, because that's a huge component as to why your rates are so good. So make sure we understand that.
Yeah. So again, that's our contracted rate. So whoever the insurance company is that your employer may provide for you or what have you, that's our rate. And so it's simple, it's easy to understand. It's not going to change any because they certainly don't want to pay us any more than they have to.
Got it.
Whereas the hospitals, again, you generally will have the scan itself. You'll have the radiologist who actually reads it. Ours are all lumped into one big bill. And I will say on the technology side from a service standpoint, as Scott was talking about, one of the things that we take a lot of pride in, I think, is that we've got great equipment. So we've gone out and put some of the latest and greatest in technology. Today we're installing a brand new MRI unit that has silent MRI technology, which is kind of the new,
nice.
The newest thing out there. We've got a stand-up MRI for people that are claustrophobic or in pain when they lay down.
Right.
Larger bores, which allow us to scan patients up to 550 pounds. So it really does. It's a totally different environment than going to the hospital and having it done.
Well, it sounds fantastic, and make sure everyone knows where you're located. I know you said you had several, so let us know those spots.
So we've got 13 locations around Metro Atlanta.
Yep, you got Decatur. Help me fill this in.
There you are, right up on the screen. We'll help you out.
So Decatur, Lawrenceville, Cumming, Canton,
Powers Ferry.
Yep, West Cobb, Hiram, Marietta.
Everywhere.
All over. On the
Good.
south side is really Noonan and Fayetteville.
Good.
So we've got a good coverage all the way around Metro Atlanta.
Fantastic. We weren't trying to quiz you there. So we'll help you out
It's
with
a lot
that.
to string off.
It is a lot. It is a lot. Well, congratulations for your success. Any last minute things you want to add? Best way to make an appointment?
Yeah, we'll say. I mean, the other thing that's nice is the centers are open 7 days a week. Most of them are open from 7 a.m. till 11 p.m. So we can help people that have work conflicts or scheduling conflicts or whatever. And truly, you can have your physicians call us directly. You can call yourself. I think the important thing, again, we talked about taking control of your health care, is just because they schedule you at the hospital does not mean you have to go to the hospital. You truly do have a choice.
Love it.
And let me say this on that point, going back to what you mentioned about global rates. We encourage patients to contact us and ask us what their cost is going to be.
Sure.
We also encourage you to do that if you're scheduled at the hospital. Compare those rates. You will find a significant difference, and all providers should be able to provide you a fairly close estimate as to what your cost out of pocket is going to be. So don't accept that they can't give you that. A lot of hospitals don't like to give you that, but demand that because it's going to come out of your pocket and you deserve to know.
Exactly. Do your homework, do your due diligence. Thank you so much, gentlemen. Always a pleasure.
Well, thank you.
And if you would like to contact American Health Imaging, please give them a call now. It's 855-MRI-CHOICE, or log on to AmericanHealthImaging.com.